Today we are going to talk about heel spurs. A spur is a typical bony protrusion that forms in the calcaneus, i.e., the heel bone, usually due to a buildup of calcium. We can distinguish between two types of spurs, namely plantar spurs, which are found in the lower part of the calcaneus, and posterior spurs, which are found at the insertion point of the Achilles tendon. These two types of spurs can occur separately or together. In this video, we will discuss the plantar calcaneal spur, i.e., the one under the heel. It is essential to understand that plantar spurs are almost never the cause of pain, but rather the result of chronic inflammation. In terms of causes, we can say that spurs often develop as a result of 1. Plantar fasciitis, which is inflammation of the plantar fascia, a band of fibrous tissue that extends from the heel to the toes. When the plantar fascia is subjected to repeated tension and stress, it becomes irritated and can cause micro-injuries at the point where it attaches to the heel bone. This process stimulates the accumulation of calcium in the area, leading to the formation of the spur. We therefore reiterate that it is essential to think of the spur not as the cause of the pain, but rather as the result of inflammation that has been going on for some time. 2. Flat feet or high arches. These biomechanical abnormalities can increase stress on the muscles and ligaments of the foot. 3. Overweight. Extra weight can increase pressure on the heel and promote the development of spurs. 4. Wearing inappropriate shoes, footwear without adequate support or cushioning can put stress on the foot. 5. Reduced elasticity of the calf muscles or Achilles tendon. This causes continuous tension on the plantar fascia, which will then undergo chronic inflammation. Symptoms that lead patients to seek medical attention may include 1. Acute heel pain, especially when walking or putting weight on the foot. 2. Swelling and irritation of the lower part of the heel. 3. A pricking or stabbing sensation that can be felt under the heel, especially in the morning or after resting. How is it diagnosed? As always, the diagnosis is based on the collection of the patient's complaints, a clinical examination, and, if necessary, instrumental investigations such as blood tests or radiological examinations. The main steps in the diagnostic process are 1. Medical history. The doctor will collect information about the patient's symptoms and medical history, such as the duration of the pain, any activities that worsen it, and pre-existing medical conditions. 2. Physical examination. During the clinical examination, the doctor will assess the location of the pain, usually under the heel, the presence of swelling or redness in the area, and sensitivity to touch or pressure on the bottom of the foot, especially near the insertion of the plantar fascia to the heel. 3. X-ray. This is the initial examination, but it must be done with the patient standing in order to better define the orientation of the joints when stressed by the weight of the body. Magnetic resonance imaging, MRI, is required less frequently, but may be useful if it is suspected that the pain is caused by other conditions such as a stress fracture, tendon injury, or joint inflammation related to osteoarthritis, for example. Ultrasound can help to see the condition of the plantar fascia, while MRI can provide a detailed image of the soft tissues and bone structures. Ultrasound is a less accurate test than MRI, but MRI is more expensive for insurance purposes. Although diagnosis is generally easy, there are cases where the pain is caused by other less common problems such as 1. Fasciitis, which is inflammations of the bursa, a small sac containing fluid that cushions the bone and joint structures. 2. Stress fractures. These are small cracks or breaks in a bone caused by overload or repetitive stress rather than a single violent trauma. This type of fracture develops gradually over time, when the bone is unable to repair the damage caused by repetitive activities. 3. Neuropathies or nerve disorders that can cause heel pain. In particular, the Baxter nerve can become irritated or compressed, causing a condition known as Baxter nerve syndrome or inferior calcaneal nerve entrapment. This disorder can lead to pain in the heel area, which is often confused with plantar fasciitis. Treatment of heel spurs depends on the severity of symptoms and the underlying cause, such as plantar fasciitis. Here are the main treatment options. 1. Rest and activity modifications. Avoid activities that worsen heel pain, such as walking or running on hard surfaces. 2. Avoid walking barefoot and avoid wearing flat shoes, such as flip-flops or ballet flats. 3. Ice and compression. Apply ice to the painful area for 10 minutes at a time, several times a day, to reduce inflammation and relieve pain. Using a compression bandage can help reduce swelling. 4. Anti-inflammatory medication. Non-steroidal anti-inflammatory drugs such as ibuprofen or naproxen are often used to reduce the pain and inflammation associated with plantar fasciitis. 5. Orthopedic insoles provide arch support and heel cushioning, reducing stress on the plantar fascia and heel bone. 6. Heel pads or shock-absorbing insoles can be inserted into shoes to better distribute weight and relieve pressure on the heel. 7. Physical therapy, in particular to stretch the plantar fascia and calf, but also to perform shockwave therapy sessions. 8. Stretching exercises. This is undoubtedly the best method for reducing pain in the vast majority of cases. There are many types of calf stretches, but I recommend only performing the stretches shown in the link at the end of this video. 9. Massage and manual techniques, such as foot reflexology, to reduce inflammation and improve circulation. 10. Acupuncture can be considered to relieve chronic pain. 11. Taping or bandaging, application of special bandages to support the plantar fascia. 12. Cortisone injections in cases of severe and persistent pain. Corticosteroid injections may be recommended to reduce inflammation around the heel. However, these injections should be used with caution due to the risk of side effects, such as weakening and possible rupture of the plantar fascia. 13. Shockwaves. Shockwave therapy is a non-invasive treatment that uses high-energy sound waves to stimulate healing of damaged tissue and reduce pain. Weight loss. Maintaining a healthy body weight reduces stress on the feet, improving symptoms. What to do if all conservative methods fail? Most cases can be managed with conservative methods, i.e., non-surgical methods, but in rare cases, if the pain is persistent and severe, surgery may be necessary. Surgery is extremely rare and is generally never considered before conservative treatment has been tried for at least 6 months. If you would like more information about the type of surgery performed in these cases, please click on the link to the video on plantar fasciitis at the end of this presentation. So what conclusions can we draw? 1. Heel spurs are much more common than we think and can also affect people who have no symptoms in their feet. 2. The spur is the result of chronic inflammation, which very often stems from functional overload due to reduced elasticity of the calf muscles. 3. Most patients respond well to conservative treatments. 4. The most effective approach includes a combination of rest, physical therapy, orthotics, anti-inflammatory drugs, but above all, a calf stretching program. 5. Surgery is rarely necessary and is only considered as a last resort after at least 6 months of conservative treatment. Thank you for subscribing to the channel and sharing the video if you find it useful.